So this morning, as we are every Tuesday and Thursday, we're joined live with Dr. Dana Hawkinson, University of Kansas Health System. Dr. Hawkinson, as always, we appreciate your time. Thank you very much. So there were some studies that came out this week from Harvard saying for social distancing restrictions to be lifted, which is what everyone wants to happen, we need to be performing about 500,000 tests every day. Right now, lawmakers can't seem to agree on the best method to get that done. What is the best way to get that number up? Because right now, that same study said we're at about 125, 150,000 tests nationwide a day. How do we get that number up?
Yeah, there's been so much consternation and debate between all the executives in our country and the health departments and the CDC. For sure, I think we need to make it more available. You know, right now we are testing for the infection itself. We are doing the nucleic acid test, not the antibody test. And so I think to do that and to get those numbers, we really need to be able to roll it out to the general public in the same way that we can test for influenza infection by doing a simple test and getting it done at so many different places, at clinics, at hospitals, out in our rural communities, things like that. And I think that's the best way to roll out those tests and really get it out to the general public and to the bigger numbers and the testing that they're talking about.
Doctor, the World Health Organization is recommending the national rate of positive tests be between 3 and 12% before reopening the economy. And we've just been looking at our local numbers. Johns Hopkins showing about 10% of people tested test positive in Kansas and Missouri. So two questions here, doctor. If I'm sitting at home going, okay, well, that's less than 12%, maybe it's not as bad here. Does that mean that we can start reopening things? Is this a lack of number of people being tested, or is it still too early because other places are seeing it worse? What would you tell those folks wondering why or why not we can start reopening soon?
Yeah, and I think every area in America is different. Certainly we're different than New York or Detroit. I think it also has to do with the bias of who you're testing. You know, what populations are you testing? Are you just testing nursing home patients or hospitalized patients? It really needs to be rolled out to the general public, and if you can get those testing rates for the general public, again, for something like influenza where anybody can go get a test, that's kind of what we're looking at. So we really don't know. That's the best numbers we have from the people that have been tested, but we don't know the full general public percentage of positive, and that's really what we're looking for. What's the true prevalence of the disease in the general population? Because some people may be ill for a very short amount of time, may have mild to hardly any symptoms at all. And so that's really the thing, is we need to get the testing to the general public and make it easy for them to get tested.
I want to ask you about protesters quickly before we let you go here on this first chat this morning, because we can't fault people for wanting to get back to work. People are losing their jobs, they're losing money. People want to get back to a normal life, and it's not wrong to want that. But we're seeing these protesters right now, and it seems like they're making this a lot about people's different level of fear. We heard from one person yesterday on the Kansas City Plaza talking about, listen, if you're afraid or if you're worried about that, that's up to you, but those of us that aren't want to get back to work. This is... You've made your point, and your colleague Dr. Stites has made a point pretty clear that this is not about fear, it's about the chances of getting other people sick. Is that still fair to say is why these protesters maybe have a little bit of a different take on what's going on there? It's not fear-based, it's actually how you can get other people sick when you head out?
Right, absolutely. You know, the answer, and I've heard some of their arguments, and the answers to all those arguments are yes. Absolutely, I agree with a lot of those things. But it's not you getting sick, it's if you bring it to your loved ones. And even some of the people that have been protesting certainly appear to be in that higher risk category of age and things like that, and so they could get ill as well. Yeah, we do want people to work, and we want people to thrive and be able to earn a living, but we need to determine the best time to do that so that we can, number one, not get as many people infected, not get as many special populations infected that can progress to critical illness, and also continue to not overwhelm our healthcare system and our supply chain, because we need everybody to be well. We need the people that are working at the plants, making our products, delivering our products, and our cashiers at the stores, stocking the shelves, the stockers, as well as the people that are working the cash registers. So we need everybody to be well. So we really have to determine the best way to go about that to keep as many people from being infected as possible.
It's Dr. Dana Hawkinson joining us this morning. Thank you, Dr. Hawkinson, always for answering those questions. We're going to speak to you again in about 5 minutes from right, or about 10 minutes from right now. Thank you very much.